1 million deaths, a grim milestone for a pandemic that's not even a year old. In 10 months, more people have died from COVID-19 than from HIV, malaria, the flu, and cholera combined. A hefty body count for a microscopic pathogen, and some experts think it's an undercount. The pandemic isn't done yet. Cases are spiking in India and Europe. Complacency and frustration are growing.
People had a fear of the coronavirus in March and April, but they don't anymore. Some are also leaving their homes because they have to go to work. They don't have any money, and they don't have any other options.
As the numbers continue to rise, how long before the next milestone? This is DW's COVID-19 special. Hello and welcome to the show. I'm Stephen Beardsley in Berlin. 1 million deaths in 10 months. What began as a mysterious respiratory disease in Wuhan, China, has now spread around the world, leaving a significant body count in its wake and showing little sign of abating in the near future. Here's a look at how we reached this point.
The first death outside of China was reported in the Philippines on February 2nd. Just 12 days later, France confirmed the first victim in Europe. At the end of February, the United States reported its first death. On June 28th, the global death toll hit 500,000, and just 3 months later, the millionth victim was confirmed. The U.S. has the highest death toll so far. It also has the highest number of cases, followed by India and Brazil. Spain has the most confirmed infections in the European Union. With cases surging across the world, experts expect the global death toll to climb rapidly in the coming months.
Now, one of the countries worst hit by the pandemic wasn't on that last list. Peru, which has topped 800,000 infections, has had one of the world's highest mortality rates, and its economy has shrunk by a whopping 30%. But new cases are slowing, and that's prompted the government to begin easing restrictions. Many fear that they're acting too soon.
Finally able to be by her husband's side. This desert cemetery in northern Peru is the final resting place for local coronavirus victims. Now that restrictions have been eased, relatives are allowed in to visit, even though it isn't the spot Ana Maria and her husband had planned for. When I went to town to make burial arrangements, they told me I couldn't bury him in the plot we had chosen. I was told that an order had been issued that everyone who died from COVID had to be buried in this cemetery. Others are still fighting for their lives. Peru's president says the country's healthcare system is stronger now than it was at the beginning of the pandemic. And the government is expanding testing, including in low-income areas of the capital Lima. So with the rate of new infections on the decline, the government is pushing ahead with plans to reopen more of the economy, and even start letting in international flights, starting with neighboring countries. But some health experts are warning against reopening too fast. Reopening gyms, bars, discos, and other forms of entertainment will be terrible. So yes, it could bring about a second wave quicker. I think we definitely need to reconsider these steps. The fear is that Peru could repeat the pattern of other countries seeing a rise in cases, followed by a new wave of mass burials.
I'm joined now by Alan Lopez. He's an epidemiologist and professor at the University of Melbourne, which is where he joins me from. Professor, it's good to have you on the show. You've said that this death count could actually be a vast undercount. By how much?
Well, it's hard to say, but it's probably likely to be somewhere between 30 and 60% of an undercount due to a number of factors.
Why is that? What are those factors?
Well, there's four principal factors, Stephen, that I think are driving the numbers down. One is that doctors are still learning how to apply the WHO rules to certify. COVID deaths, and they're getting used to that. Until they get used to it properly, they'll be undercounting deaths. Secondly, COVID-19 kills people in ways that we're still learning about. In other words, that they magnifies up the background risks. If you've got hypertension, if you're a smoker, if you're overweight, if you've got chronic lung disease, then it's likely that COVID-19 is going to be more serious for you and will kill many of the people with those conditions, those comorbidities. Thirdly, COVID-19 is having a big impact on health services. So in developing poor countries, we're seeing programs, essential programs like HIV control, TB, malaria, are all being affected. And so many of the people who need those services are not getting them and are probably dying as a result. And even in rich countries, we see people not turning up for cancer screening when they should be. And finally, and perhaps most importantly, many, many deaths in the world go uncounted. About 1/3 of deaths go unregistered each year. And even many of those that are registered don't get a proper, correct cause of death. So it's likely that COVID-19 suffers from all those conditions as well.
You mentioned there the comorbidities. Can we say if there's a profile to the average coronavirus death from what we know about the death count so far?
Well, the main thing that drives that defines COVID-19 deaths is age. The vast majority of people who die from COVID-19 die above the age of 70. And the sex ratio from countries where we can count it reliably suggests that about for every female who dies, there's about 3 males. So we've got a fairly clear idea of the age and sex composition of mortality.
Are we slowing down the death rate? Since we've been going at this for about 10 months now, have we learned enough to slow it down?
The answer is no. We have not slowed it down. I don't know whether we've learned enough to do that, but we certainly haven't applied it. Death rates are rising. We're seeing second waves in several countries in Europe. We've seen those in my country, in Australia. Deaths are rising. They're rising steadily, and they're going to rise a lot further.
When should we expect the next milestone, say 2 million, 3 million? Do you have a prediction?
It's always difficult to predict, but my prediction is that by the end of this year, by December 31st, we'll probably see at least 2 million, possibly as high as 2.5 million COVID-19 deaths worldwide.
Now, Professor, are deaths the best way to understand the impact of this disease in the pandemic?
I don't think so. I think the actual numbers of deaths, as frightening as they are and as frightening as they're going to be, don't tell the full story. COVID-19 kills people primarily at older ages. And in terms of preventive priorities that public health need to be concerned about, we talk about the number of years of life lost on average from each death. And in terms of COVID-19, most of those who died at older ages, and so they tend to lose much less years of life than, for example, a comparable number of deaths. Road traffic accidents, for example, kills 1.2 million people every year. The vast majority of those are a lot younger than the COVID deaths. And so you could argue that road traffic accidents ought to be getting at least as much public health attention for prevention as COVID-19.
All right, Alan Lopez, professor and epidemiologist from the University of Melbourne. Thank you very much.
Thank you.
Well, our science correspondent, Derek Williams, has been busy looking into your questions about the pandemic. Over now to Derek.
Many of the social controls put in place are based on asymptomatic transmission. What evidence is there for such a phenomenon?
Do people who are asymptomatic transmit SARS-CoV-2 to others? And if so, then how infectious are they? This has been one of those issues that's proven very difficult to come to grips with in the course of this pandemic for a couple of reasons. First of all, because we only really recently began to detect asymptomatic people on a wide scale. Second, because today's asymptomatic patient can turn out to be only pre-symptomatic and start showing symptoms tomorrow. And we're pretty sure that pre-symptomatic carriers can be highly infectious. Third, because the viral load an asymptomatic patient carries is usually very similar to that of someone showing symptoms. So what evidence is there that people who test positive for COVID-19 but don't ever develop symptoms, how likely is it that they can infect others? A preprint paper set for publication soon shows how tricky it can be to prove, but the researchers think they did it on a flight from Italy to South Korea carrying nearly 300 passengers who at the time displayed no COVID-19 symptoms. Before boarding, all of them were given N95 masks, and most wore them throughout the flight, except at mealtimes and when they went to the bathroom. When the passengers arrived in Seoul, they were quarantined straight away for 2 weeks, and all of them were tested on the first day and the last day of that quarantine. 6 people tested positive for COVID-19 that first day of quarantine, but they never developed symptoms. They were confirmed asymptomatic carriers. But one woman who tested negative on the first day of quarantine developed symptoms on day 8 of it. She had sat a few rows away from an asymptomatic patient and used the same bathroom as them. Because of the timing and what we know about the virus's incubation period, the researchers concluded that she was very likely infected by one of the asymptomatic passengers on board the plane. Sounds kind of like a Sherlock Holmes mystery, doesn't it? It just goes to show you, though, how difficult it is to acquire and interpret this kind of evidence. Many studies have tried, but so far, none of them has been clear-cut enough, really, for big health authorities like the WHO or the CDC to take a stand on the issue.